Signs and symptoms of Kaposi sarcoma. Lesions can be found on the skin, but spread somewhere else is also common, especially the mouth, the gastrointestinal tract, and the respiratory tract. Growth can range from very slow to explosively fast, and is associated with significant mortality and morbidity.
Skin. KS lesions are nodules or blotches that may be red, purple, brown, or black, and are usually papular, in other words, palpable or raised. Commonly affected areas include the lower limbs, back, face, mouth, and genitalia. Lesions on the legs or in the groin area can sometimes block the flow of fluid out of the legs. This can lead to painful swelling in the legs and feet. Skin lesions may be quite disfiguring for the sufferer and a cause of much psychological pathology.
Mouth. In the mouth, the heart platelet is most frequently affected, followed by the gums. Lesions in the mouth may be easily damaged by chewing and bleeding, or suffering a secondary infection, and even interferes with eating, swallowing, or speaking.
Outside of the eye and inner part of the eyelids. Lesions may also form in these areas. These lesions are usually not painful or itchy.
Gastrointestinal tract. Involvement can be common in those with transplant-related or AIDS-related KS, and it may occur in the absence of skin involvement. The gastrointestinal lesions may be silent or cause weight loss, pain, nausea or vomiting, diarrhea, bleeding, which can be either vomiting blood or passing it with bowel movements, malabsorption or intestinal obstruction. Bleeding from the lesions in the stomach and intestines can be so slow that the blood isn't visible in the stool, but over time the blood loss can lead to low red blood cell count, which is anemia. This can cause symptoms like fatigue and shortness of breath.
Respiratory tract. Involvement of the airway can be present with shortness of breath, fever, cough, hemoptysis, which is the coughing up of blood, or chest pain, or as an incidental finding on chest X-ray. The diagnosis is usually confirmed by bronchoscopy when the lesions are directly seen and often biopsied. Transmissions of Kaposi sarcoma.
An alternative theory that has also been introduced states that the use of saliva as a sexual lubricant can also be a major mode of transmission. Prudent advice is to use commercial lubricants when needed and avoid deep kissing with partners with KSHV infection or whose status is unknown. KSHV can also be transmitted via organ transplantation and blood transfusions. Virus testing must be done before these procedures to rule out KSHV and to effectively limit iatrogenic transmission. Kaposi sarcoma is also transmitted via fecal contact.
Created using Powtoon.